Okay, so I think one other issue that it's very important that you've kind of highlighted um, is is how do we attract the next generation of public health leaders on the continent? That leads to a crucial area of leadership and mentoring. So my question to both of you is that what you've been in the leadership space for a long time. What strategies have you found um, most compelling in mentoring young professionals, especially from Africa? I'll start with Ms. Vivian.
Okay, thank you for that, Banda. I think one thing I found, leading an organization like Nigeria Health Watch, which, since its inception has evolved in terms of the work we do, is we actually have quite a young team. And I remember when, we relocated back to Nigeria and I started running Nigeria Health Watch. And I used to always wonder why a lot of the junior team members would, sit quietly in meetings and, you don't often hear, contribution. And someone pointed out to me that, culturally in Nigeria and often in many of our countries in Africa, we have this system of hierarchy where there's a power distance between junior and more senior members of a team. So you'd have a meeting and you'd have junior and more senior members of the team. And often it's the more senior members who lead and who dictate and direct the younger ones what to do, and the young ones sit and listen. And even our educational system encourages a system where, yes, there is a hierarchy. The lecturer or teacher gives you information, you, the student, taking that information, repeat it out. There isn't enough interrogation within even our curriculums whereby a student can put his hand up and say, Sir, I don't actually agree with what you
Mhm.
said. Can you please, maybe this is what I think. That's almost unthinkable. So
Mhm.
when you come down to the work setting, you often have young people who are never really don't feel free to share their point of view because nobody's ever really asked them. They're used to the hierarchical structure. And something really tried hard to change, and it did, I think for me it did take a while, was creating that space where whoever you are, and this is what I always say to team members, I want to hear your ideas. I don't have all the ideas. Of course, I have more work experience, but I certainly do not have all the ideas. I actually want to hear your idea. So, creating a culture within an organization where, for instance, people call me by my first name. Initially, many people find it difficult, but I really want to take away that sort of power distance and create an environment where young people are able to share their views. Because when that happens, often you have people who have brilliant ideas and feel that freedom to grow. And it's only through enabling, members of my team to share their views that they themselves are able to see what they can fill and to really fulfill their potential. So I think one thing, I always encourage, and I think has worked for us as an organization, is creating a space, a safe space where people can make mistakes and learn and grow and take that experience into whatever future career they choose to go into.
Yeah, I think that is such a powerful message. Hopefully, we'll create that culture in most of our institutions to really help nurture the next generation. Dr. Chikwe, how do you think we can create more opportunities for emerging public health leaders? I know sometimes it's difficult for those from um, underrepresented regions to actually break through into the global limelight. How do you think we can create more opportunities for people who are really passionate about making impact?
Um, I think we just keep pushing and bringing them in and supporting them to grow. You know, one of our biggest, I reflect, one of our biggest successes at NCC was enabling the growth of so many young people. And I mean, one of the consequences of that, and I'm still not sure whether it's a good thing, whether it's a net positive or a net negative. Um, Many of them have left NCC and have gone into uh, many organizations. But if I think about the number of colleagues that are working at Africa CDC, WHO, SEPI, are doing master's programs, PhD programs all across the world. They will all come back
Yes.
to push progress on our continent. So even though there's a short-term loss, if you want to perceive it that way, I am incredibly positive about the future because all of them are super motivated about contributing to Nigeria and to the continent generally into the future. So I think there's so many opportunities these days. Every time you look around, there's a new fellowship for emerging leaders on this and that. I think the world has woke up into this need to support the personal development of young and middle level colleagues working in our institutions. So there's an era right now of going to make the most out of these opportunities, whether you're in a short-term program, longer-term program, or just in a job. What we need to ensure is that they come back to work in the NCDCs, the MPACDAs, the NAFDACs, the Africa CDCs, the Ghana Health Service of the future. And really, so that's to me the challenge. I'm not too worried that people are leaving to seek new opportunities. I think that's the natural tendency. I did the same, and Vivian did the same, but we've all come back to contribute to our continent. You're doing something similar, contributing in many ways. So the key thing I'll tell young people is take every opportunity you see you can grab to develop yourself, and ultimately your heart will bring you back to the continent that we love.
Yeah, yeah. Um, hopefully, we have these kind of mindset imprinted in our leaders and also the next generation, to continue supporting people, to continue supporting what is really the future of our continent.